Our goal is to keep people well and functioning. There are things worse than death, but our attempt is to keep people well and useful and happy.
1942, a year when the United States was deeply entrenched in World War II, the New Orleans Jazz Revival was officially underway, and 5 medical pioneers from Tulane University were attempting to form a group practice that would turn the medical establishment in New Orleans upside down.
Dad talked to the man who was then president of New Orleans Medical Society, and he said, "Now, why are you all against us?" He says, "Because it's unfair competition." He says, "Why is that?" "Because y'all can do better medicine that way." He said, "My God, that's what we all ought to be trying to do. Why don't you form your own clinic?"
Initially, the 5 men were denied a loan. And then by chance, founder Guy Caldwell was making a house call to Mrs. Rudolph Heck, whose husband was the chairman of Hibernia Bank. Their conversation quickly turned to the clinic.
He said, "Well, we went to your bank and they turned us down." And he said, "Go back tomorrow." And so they did, and needless to say, they did get the loan.
Forging ahead, Doctors Alton Ochsner, Edgar Burns, Guy Caldwell, Francis Lejeune, and Curtis Tyrone formed a controversial medical group practice, naming it Ochsner Clinic after its chief visionary, Alton Ochsner. But no good deed goes unpunished, and the medical community was outraged.
But Ochsner was met with blowback from the New Orleans business community and from doctors in town because they felt that it would give an unfair advantage to a large clinic.
All 5 men on Holy Thursday night received 30 pieces of silver, 30 dimes, in a leather pouch. Attached to it was an anonymous note that said, "From the physicians, surgeons, and dentists of New Orleans to help build your clinic." Of course, the connotation were that they were Judases.
Well, I spent mine, but Dr. Lejeune kept his, and he still has it, but I spent mine. I was glad to get the $3 at that time.
With the clinic up and running, it quickly became apparent that a hospital was desperately needed for financial stability and to care for a growing patient population. Founder Guy Caldwell brokered a deal acquiring Camp Plauché, an old World War II Army installation. Because of the laws at the time, a non-profit hospital was formed separately from the clinic. This hospital would affectionately become known as Splinter Village.
And it was old wooden floors and everything, and fans, of course. And they would walk around in their stocking feet. And they would stick splinters in their feet from the wooden floors. And that's where it got its name, from Splinter Village.
Dr. Caldwell said, had the deal not happened, it could have broken up the Ochsner group practice. But he made it happen, keeping the founder's vision alive. People came from all over the region and as far away as Latin America to this popular health center. But over time, Splinter Village began to show its age, and a new state-of-the-art hospital was needed. Land became available on an old stable grounds located on Jefferson Highway, and construction of the Ochsner Foundation Hospital began.
And finally, the doors of this new hospital opened in 1954. And it was certainly a great day for all of us because Camp Plauché Hospital was rapidly deteriorating.
I remember when they first opened the hospital here and they had, operating rooms. See, they could never hardly get in operating rooms when they went to other hospitals. Each one of those 5 men had an operating room that they knew was theirs.
It was here that Alton Ochsner continued to transform the hospital experience.
But I've always maintained that the family is ill too, and they require just as much consideration as does the patient.
People don't realize that the first family lounge in the world was started here. And we started the first recovery room, intensive care, in the country.
But with the clinic located uptown and the hospital in Jefferson Parish, there was one big gap that needed to come together.
For years, the hospital was in one place and the clinic was in another place. And of course, that was against the concept to begin with.
So the Ochsner Clinic, a first-class medical facility, was built directly adjacent to the hospital in 1963.
Ochsner in the early 1960s was the culmination of the dream of the founders. We had a new hospital, we had a new clinic building, we had a hotel for out-of-town patients, and the efficiencies were great.
The number of people that we can take care of through the medium of those whom we treat is limited. But the number of people whom we can influence through the medium of those whom we've trained is unlimited. And I think this is our greatest contribution.
You never forget an experience with Dr. Ochsner and his teaching. That was why he's such a great teacher. He had a way of always asking you why.
And whenever Ochsner got an invitation to go someplace and talk, by gosh, he was there. And the only thing he enjoyed doing more than making one talk was making two talks.
From the day the foundation opened its doors, Ochsner was committed to research and medical education. Early research had been done in a lone house located on Britannia Street, but 1959 saw the opening of Ochsner's first dedicated research laboratory building. Through the 60s, medical research thrived in the areas of both cardiovascular research and cancer diagnosis, paving the way for future medical breakthroughs. Over the ensuing decades, Ochsner's legacy of research was continued by Dr. Young-Sung Choi's groundbreaking cellular immunology cancer studies and Dr. Edward Froehlich's landmark discoveries in the management of hypertensive diseases.
I think that the initial studies in animals and then later the initial studies in man were done in this institution.
It is research that has paved the way for medical innovations, keeping Ochsner at the forefront of patient care.
This is why it's just crucial for Ochsner to keep the link, the connection between what goes on in the clinic, what goes on in the hospital, and what goes on in the laboratory.
From the laboratory to the classroom, medical education was a fundamental aspect of the founders' vision. Throughout the history of Ochsner, there have been vibrant undergraduate, graduate, and residency programs. In 2009, Ochsner expanded its medical educational efforts when Ochsner Health System and the University of Queensland Medical School in Brisbane, Australia, partnered to become the first global medical school in Louisiana.
I'm proud to announce that today, Ochsner Health System has partnered with the University of Queensland School of Medicine to create the University of Queensland School of Medicine Clinical School at Ochsner in Louisiana.
This unique joint affiliation with Queensland has allowed Ochsner to truly become a global medical and academic leader. Ochsner now trains over 500 medical students and over 350 residents and fellows in graduate medical education programs each year, fulfilling the founders' mission to train the next generation of physicians.
But we are really the first partnership that is looking at medical education as a global enterprise. And so there are no models out there. We're blazing the trail, we're learning as we're going, and we're making it great.
He innovated surgical treatment for conditions that up to that time were simply not amenable to surgical treatment.
Innovation has always been an integral part of Ochsner. Throughout its history, people have been drawn to this institution that encourages excellence in the practice of medicine.
They came here because there were other minds that were determined to make medicine better, do research, and they helped one another.
Alton Ochsner himself was an innovator, spearheading anti-smoking efforts in this country, even in the face of criticism from his colleagues.
He's the leader in connecting cigarette smoking to lung cancer. That was considered bizarre R&D kind of thought when he was promoting that, but he proved to be exactly right about it. So you're dealing with somebody who's not just a doctor, you're dealing with one of the pioneers of the medical profession in the 20th century.
From Alton Ochsner through today, cutting-edge medical advancements have always been a cornerstone of Ochsner.
We have pioneered in almost every aspect of surgery and medicine in the state and in the South. Practically every cardiovascular procedure that's ever been done first, we did it.
After years of revolutionary work, Ochsner performed its 500th heart transplant in 2000. This allowed Ochsner to join an elite group of medical institutions to have achieved this medical milestone.
And where we've arrived is to place ourselves with that small group of institutions who have sustained a very long-term commitment to this program, a multi-organ transplant program, a program that treats all patients, no matter how sick they are, no matter where they're from. That's what the Ochsner Clinic and the Ochsner Foundation are about.
But the caring part, the compassion component, being the advocate for patients will always be what we're about.
For 70 years, Ochsner nurses have been on the front line caring for patients and their families. And from day one, Ochsner nurses have always been the most highly trained and advanced professionals in the healthcare industry.
In those days, the patients were operated on for such large procedures, much larger than anyone else was doing at that time. And we as students had never seen anything like this.
The tradition of nursing excellence continues at Ochsner, and there remains a deep appreciation for the vital role nurses play in treating and healing patients.
If you look at the number of nurse professionals that we have in the system and in our hospital, what makes us a great hospital, what makes this hospital work, are the nurses.
Nursing at Ochsner was highlighted in 2003 when Ochsner received magnet status by the American Nurses Credentialing Center, placing nursing at Ochsner among an elite group of institutions where nurses are recognized as experts in the delivery of patient care.
At Ochsner, nursing has really prided itself in having our nurses be the best of the best.
Whatever you think you need, think fourfold, because it won't take long before you're going to outgrow whatever size building you have.
At every turn in the history of Ochsner, there has been constant growth. From Splinter Village to the main hospital, to additional floors and towers, Ochsner has never known a period without growth. One of the largest periods of expansion began in the 1980s, when in an effort to bring care closer to where the patients lived, the medical practice was remodeled with the formation of primary care services and the development of satellite clinics.
We couldn't stand still. We were either going to have to grow or shrink. We embraced growth.
And from the 80s through 2000, Ochsner continued to develop state-of-the-art facilities and also expanded into wellness and preventative care. All the years of innovation, research, and expansion now positioned Ochsner as the preeminent healthcare system of the South.
You started getting people feeling in New Orleans, while other healthcare providers came and went, that Ochsner was sort of a rock of Gibraltar in Louisiana, that it was a place that you knew that if you got to Ochsner, you would be able to get a proper diagnosis and hopefully get fixed.
If we merge, it's not the clinic is going into the hospital or the hospital is being taken over by the clinic. Together we have a fresh opportunity to revisit the birth of the organization.
From the start, Alton Ochsner had imagined a foundation that would be part of the clinic. At the time, the laws of the state didn't allow for physicians to work in a nonprofit situation.
But over the years, the laws had changed, and Ochsner's modern era began in 2001 with a third attempt to consolidate the clinic and the hospital into a single organization.
The palpable threat to the organization that, hey, the times are changing and we're going to have to do something, otherwise we're liable not to be here.
On August 31st, 2001, after years of tireless work and negotiation between all parties, the unification of the Ochsner Clinic and Alton Ochsner Medical Foundation finally proved successful.
From that point on, we were a unit. There was one board, one set of executives. It just made the whole thing so much easier to run and administer, and it became a much, much more efficient organization.
We could fulfill our destiny. We could become one organization. We could, as we said, go back to the future and fulfill the original plans of the founders.
Now acting as one, Ochsner combined its talent and resources, laying the foundation to become the regional leader in healthcare.
I think everything you see happening today could never have happened if we hadn't done the unification back in 2001.
In 2005, Ochsner saw its finest hour and its biggest challenge as an organization. On August 29th, Hurricane Katrina devastated the New Orleans region. But Ochsner was able to continue providing care to the community by remaining open throughout the storm and its aftermath.
I just want to let you guys know you are doing an unbelievably great job here. The single best, most professional job in the city is what you guys are doing here. You're being so great to patients and you're absorbing people, and just keep it going because it's incredible work you guys are doing, honestly.
There are moments in time that you have an opportunity to distinguish who you are and who you're not, and I think there are a whole lot of people that have decided this is their moment.
I bet you that the founders will be proud of what we did. I mean, historically, we are the best.
You always can tell about an institution when the deal goes down, when the crisis arrives. And you watch Ochsner perform in this, I would say, nearly flawless fashion during the largest catastrophes in U.S. history.
In the days and months after Katrina, Ochsner continued to support the community and its employees even in the face of devastating financial adversity.
We were generating substantial losses on a daily basis. Yet we all put our heads together and figured out that's what we had to do. That's what the city needed.
As New Orleans struggled to recover after Katrina, Ochsner saw the opportunity to rebuild healthcare in New Orleans and the entire region.
Ochsner is purchasing 3 community hospitals from Tenet Healthcare Corporation. Ochsner's decision to invest in these organizations is based on a desire to support health care in our city.
And this was a dice roll. This is a gamble to have acquired those. But they didn't do it as a business model per se. They just did it because it was going to help the community.
In the years following Katrina, Ochsner continued its legacy of growth and has improved health care in the community. At every turn throughout its history, Ochsner has faced adversity and come out stronger.
That is a sign of a great organization. People that can go through, deal with adversity, come out the other side, and just keep getting better.
So I've become deeply loyal to the history of Ochsner and what they've been able to do during Katrina, and then stay there in the community and become really the progenitor of the New Orleans.
What the founders were always looking to do was to do the best thing for the patient, do a great thing for the community, and it wasn't about them. It was about something bigger.
Continuing a history of medical excellence, Ochsner is the premier healthcare system in the region and would bring great pride to its 5 founding fathers.
They would have thought that it was all worthwhile.
Lord, we've come a long ways.
What Ochsner has really afforded to me is to be associated with excellence.
People are the whole foundation of our company. We take care of people, we teach people, we lead in the community, and people are the very, very foundation of that.
Hello, Top 100. So you guys are now known as Top 100.
We have an opportunity now for us as an organization to step up and provide the leadership and where we go in changing the American healthcare system.
Now, as a global medical and academic leader who will save and change lives, Ochsner continues to explore new opportunities around the world. The future of Ochsner is strong.
Its character has been refined in that what made it great has come to the forefront. The thirst for excellence, the innate teamwork that made this place great, the sense of higher purpose, the sense of supporting each other with the central theme of doing right by our patients.
The founders would look at what we've done here at Ochsner with a lot of pride, and that's how I look at this every day, is that we have to make Ochsner better today than it was yesterday, and we have to make the founders proud of what we're doing each and every day.
The founders always considered advancement of medicine paramount. It was never good enough just to be good. And I think the whole community takes pride in what we do. And I think that's the real key to why we're going to do well in the future.
I don't believe that if I had to do over again that I'd do anything different. A lot of people say to me, they ask me if I wouldn't like to start over again. I said, no, I've lived in the most golden age of medicine.